Chapter 7. Sleep. Sleep is when our soul actually refreshes our body. Dr. Deepak Chopra. In this chapter, I will teach you how to enhance your wellness by learning more about how to deepen your sleep cycles and rejuvenate your body. A good night's sleep is critical for your health because our brains sort the important elements of the day from the unimportant and stores memories, allowing for more efficient long-term memory recall. Our body regulates hormones such as cortisol to help manage stress, human growth hormone to repair muscle tissue, insulin to regulate blood glucose, and others. Cell turnover rids waste from your cells, leaving the immune system restored. Chronic sleep deprivation impairs attentiveness, coordination, and reaction time. It also increases the risk of obesity, high blood pressure, heart attacks, diabetes, and depression. And sleepiness is an all too common cause of accidents and fatalities in the workplace and on highways. Making sleep a priority takes time and patience, just like any other health behavior change. Consider the following tips for better sleep. From setting a sleep schedule to including physical activity in your daily routine. Some of the factors that can interfere with a good night's sleep include work stress and family responsibilities to unexpected challenges, such as illnesses. While you might not be able to control the factors that interfere with your sleep, you can adopt habits that encourage better sleep. 1. Stick to a sleep schedule. Set aside no more than 8 hours for sleep. The recommended amount of sleep for a healthy adult is 7 to 8 hours. Most people don't need more than 8 hours in bed to achieve this goal. Go to bed and get up at the same time every day. Try to limit the difference in your sleep schedule on weeknights and weekends to no more than 1 hour. Being consistent reinforces your body's sleep-wake cycle. If you don't fall asleep within about 20 minutes, leave your bedroom and do something relaxing. Read or listen to soothing music. Go back to bed when you're tired. 2. Pay attention to what you eat and drink. Don't go to bed hungry or stuffed. It is important to avoid heavy or large meals within a couple of hours of bedtime. Your discomfort might keep you up. Nicotine, caffeine, and alcohol deserve caution too. The stimulating effects of nicotine and caffeine take hours to wear off and can wreak havoc on quality sleep. And even though alcohol might make you feel sleepy, it can disrupt sleep later in the night. 3. Create a restful environment. Create a room that's ideal for sleeping. Often this means cool, dark, and quiet. Exposure to light might make it more challenging to fall asleep. Avoid prolonged use of light-emitting screens just before bedtime. Consider using room darkening shades, earplugs, a fan, or other devices to create an environment that suits your needs. Doing calming activities before bedtime, such as taking a bath or using relaxation techniques, might promote better sleep. 4. Limit daytime naps. Long daytime naps can interfere with nighttime sleep. If you choose to nap, limit yourself to up to 30 minutes and avoid doing so late in the day. If you work nights, however, you might need to nap late in the day before work. 5. Include physical activity in your daily routine. Spending time walking outside every day might be helpful, and it is a good exercise. Regular physical activity can promote better sleep. However, avoid being active too close to bedtime. 6. Manage worries. Try to resolve your worries or concerns before bedtime. I highly recommend journaling what's on your mind daily, and then setting it aside and dealing with those worries the following day. 7. Stress management might help. Start with the basics, such as getting organized, setting priorities, and delegating tasks. Meditation also can ease anxiety. 8. Aging can affect the quality of your sleep. You may wake up more often and have a less consistent sleep pattern than you did when you were younger. One of the most common and pronounced sleep changes that comes with aging is waking up more frequently. The most likely cause is some type of physical discomfort, such as the need to use the bathroom or reposition an achy joint. Other changes that are part of normal aging include getting less sleep overall and spending less time in the rapid eye movement REM cycle, the dream phase of sleep. These changes can vary quite a bit between individuals, and in general, they affect men more than women. According to Dr. Hilla Pagan, you can try some simple techniques to limit disruptors and improve your quality of sleep. Some of these techniques include reviewing your medications and supplements with your doctor or pharmacist, and consider changes to their use that could be affecting sleep quality. Stop drinking fluids within 2 hours of bedtime to minimize trips to the bathroom. If pain keeps you awake at night, talk to your doctor to see if taking over-the-counter pain medication before bed may help. While this may not stop you from waking up, you may have an easier time falling back to sleep. If you snore loudly and feel tired even after a full night's sleep, you might have sleep apnea, a potentially serious sleep disorder in which breathing repeatedly stops and starts. I used to snore loudly, and my primary doctor recommended a polysomnography, a sleep study, a comprehensive test used to diagnose sleep disorders. Polysomnography records brain waves, the oxygen level in your blood, heart rate, and breathing, as well as eye and leg movements during the study. I did my polysomnography at a sleep disorders unit within a hospital, but it can also be done at a sleep center. In addition to helping diagnose sleep disorders, polysomnography may be used to help initiate or adjust your treatment plan if you've already been diagnosed with a sleep disorder. Polysomnography monitors your sleep stages and cycles to identify if or when your sleep patterns are disrupted and why. There are different types of home sleep apnea test devices using different combinations of sensors. They generally record your breathing rate and airflow, as well as oxygen levels and heart rate. There are 3 main types of sleep apnea: obstructive sleep apnea, central sleep apnea, and complex sleep apnea. My polysomnography showed that I suffered from obstructive sleep apnea that occurs when the throat muscles relax. The throat muscles support the soft palate, the triangular piece of tissue hanging from the soft palate, uvula, the tonsils and the side walls of the throat, and the tongue. When the muscles relax, your airway narrows or closes as you breathe in. You can't get enough air, which can lower the oxygen level in your blood. Your brain senses your inability to breathe and briefly rouses you from sleep so that you can reopen your airway. This awakening is usually so brief that you don't remember it. You might snore, choke, or gasp. This pattern can repeat itself 5 to 30 times or more each hour all night, impairing your ability to reach the deep, restful phases of sleep. I now use every night a CPAP device that keeps obstructions from blocking my ability to breathe when I am asleep. The CPAP mask and tubing provide a gentle flow of pressurized, filtered air to keep my airway open, and I can enjoy a good night's sleep. Central sleep apnea occurs when your brain doesn't send proper signals to the muscles that control breathing. This form of sleep apnea occurs when your brain fails to transmit signals to your breathing muscles. This means that you make no effort to breathe for a short period. You might awaken with shortness of breath or have a difficult time getting to sleep or staying asleep. Complex sleep apnea syndrome, also known as treatment-emergent central sleep apnea, occurs when someone has both obstructive sleep apnea and central sleep apnea. If you think you might have sleep apnea, see your doctor. Treatment can ease your symptoms and might help prevent heart problems and other complications. Some medical research suggests that intermittent fasting can also improve your sleep. Intermittent fasting means that you don't eat for a period each day or week. Some popular approaches to intermittent fasting include alternate day fasting. Eat a normal diet one day, and either completely fast or have one small meal, less than 500 calories, the next day. Eat a normal diet 5 days a week and fast 2 days a week. Eat normally, but only within an 8-hour window each day. For example, skip breakfast, but eat lunch around noon and dinner by 8 p.m. Intermittent fasting improves your health. Losing weight and being physically active help lower your risk of obesity-related diseases, such as diabetes, sleep apnea, and some types of cancer. For these diseases, intermittent fasting seems to be about as beneficial as any other type of diet that reduces overall calories. According to an intermittent fasting article published in the Beacon Health System, intermittent fasting is safe for many people, but it's not for everyone. Skipping meals may not be the best way to manage your weight if you're pregnant or breastfeeding. If you have kidney stones, gastroesophageal reflux, diabetes, or other medical problems, talk with your doctor before starting intermittent fasting. According to Dr. Eric Olson, lack of sleep can affect your immune system. Studies show that people who don't get quality sleep or enough sleep are more likely to get sick after being exposed to a virus, such as a common cold virus. Lack of sleep can also affect how fast you recover if you do get sick. During sleep, your immune system releases proteins called cytokines, some of which help promote sleep. Certain cytokines need to increase when you have an infection or inflammation, or when you're under stress. Sleep deprivation may decrease the production of these protective cytokines. In addition, infection-fighting antibodies and cells are reduced during periods when you don't get enough sleep. Using technology late at night can keep you from getting a good night's sleep, whether you're doing work on your laptop or scrolling through social media posts on your smartphone. Some scientific research has even shown that the light from your phone might suppress your body's production of melatonin, the hormone that regulates your sleep cycle. Our bodies need sleep to fight infectious diseases. Long-term lack of sleep also increases your risk of obesity, diabetes, and heart and blood vessel cardiovascular disease. Being well rested is important to your health, mood, and productivity. Dr. Deepak Chopra recommends everyone get 8 hours of sleep each night. Dr. Chopra recommends practicing mindful breathing before bedtime. The best way to do this is to count to 4 as you breathe in and then count to 6 as you breathe out. This slows your breathing from an average of 14 breaths to an average of 8 breaths per minute. Mindful breathing restores self-regulation and calms the mind. Dr. Chopra recommends another breathing exercise that he says you can use to fall asleep, and it revolves around a popular mantra, words you repeat while breathing to help you relax. Say "so" as you inhale, and then say the word "hum" as you exhale. The "so-hum" mantra is derived from Sanskrit and often used in yoga and other forms of meditation. Much like mindful breathing, this meditative mantra is meant to help calm your mind. A 2015 study published in the Journal of the American Medical Association found that mindfulness meditation practices helped improve sleep quality for subjects who were experiencing insomnia symptoms. Another way to relax when you're trying to fall asleep is to close your eyes just before you lay down and recap the events of your day in your mind. On the screen of your consciousness, you see yourself as if you were on a video screen. Observe the day without judging it, and then let it go. When you do that, you actually let go of all the stresses that happened during that day, and you go to bed with a fresh start for the next day. In this chapter, I have taught you how to enhance your wellness by learning more about how to deepen your sleep cycles and regenerate your body. I hope you will incorporate some of these practices to your daily evening routine to enable you to enjoy a restful sleep on a regular basis.